We also know that in order to build a culture of health, we need leaders and partners from across disciplines, from across sectors to come together to think about health and to think about change in new ways. One of the things that is exciting about this point in time and for us being new in our work around building a culture of health is the recognition that in some ways it's already happening. And what you see on this quote on this slide is a quote from our president and CEO, Dr. Louisa Mori, and she shares here that the notion that it's rare to recognize the beginning of great change while you are living in it, because it does not present itself as spectacular. It trickles in, carried and cultivated by everyday people, and that our job is to find the earliest and strongest examples of a culture of health, share the lessons they have to offer, and serve to link together the leaders of change so they can join forces and build small victories into a national movement. And there is no quote for me, no description better to describe what the prize is about. It is recognizing that there are communities that are at the forefront of improving health by thinking about culture, by thinking about partnerships in a new way, and there's enormous opportunity by engaging with those communities, learning from what they've done, and putting their stories up on high so others can be both inspired but also instructed by their experiences and their lessons. For us, we value the partnership that we recognize through the prize in communities, but I'll also take a moment just to reflect that the RWJF Culture of Health Prize is a collaboration between the Robert Wood Johnson Foundation and the University of Wisconsin Population Health Institute. Many of you know the University of Wisconsin Population Health Institute for their work and leadership on the county health rankings and roadmaps for over the past decade, essentially. And the Culture of Health Prize is an initiative that was born out of our work together on the county health rankings and roadmaps. As I alluded to earlier with the quote that I shared from Dr. Louisa Mori, the purpose of the prize really is to honor and to elevate communities that have placed a high priority on health and that are creating powerful new partnerships and real commitments to make change. For us, the communities that have won the prize and the communities that will win the prize are emblematic of our vision of a culture of health. They really are the notion of a culture of health in action. And what we cherish and what we are excited about is that there is no one way to build a culture of health, and that communities are going to approach it differently. And for us, the prize is an opportunity to represent and to recognize all types of places, urban, rural, tribal, large, small, everything in between. Communities that are committed, again, not only to providing access to good quality care, but also to the opportunities for better health by transforming their neighborhoods, their schools, their businesses, so good health flourishes everywhere. Some specifics on the prize. I've talked about it as an honor, a recognition, an opportunity to share lessons and stories broadly across the country. But let me also point to some of these specifics. Each of the prize-winning communities receives a $25,000 prize, and I would here emphasize that it is a prize recognizing work that they've already accomplished. It is not a grant. There are no budgets required. There's no reporting that's required to the foundation after the prize is made. We also, in really trying to use our platform as a national voice, put enormous resources into video and communication support to allow our community winners to tell their story, to share their lessons broadly. And we do it with an eye towards making those communications tools that you can also use back home. We do provide monetary support for a local event, so communities can celebrate and recognize all of the partners that contribute to their work, in addition to a large national event, and you see some pictures from that national event here on the slide that has historically taken place at the Robert Wood Johnson Foundation based in Princeton, with the growing nature of the prize and our prize network. We are slowly busting at the seams in our space here at Princeton, but we remain committed to having a national event to recognize and announce our winners. The other thing, in addition to, again, this opportunity for communities to share their stories, one of the things that we hear is most important from our prize winners is access to the prize network. The prize network of other communities that have won the prize, access to the team at the University of Wisconsin Population Health Institute and the Robert Wood Johnson Foundation. All of our prize winners, are recognized not only for what they've accomplished, but their commitment to continuing their work forward. And this prize network becomes a place, becomes an opportunity for them to continue to network with their peers, continue to access new expertise, new strategies, and we are committed to continuing to provide support for that network. I've mentioned several times that we do have several cohorts of our prize winners already, and here you can see in 2013, and those are our orange dots, the first 6 communities were selected as Culture of Health Prize winners, and they were Cambridge and Fall River, Massachusetts, Manistee, Michigan, Minneapolis, Minnesota, New Orleans, Santa Cruz County, California, and again, they're all there in that orange yellow. In 2014, the 6 winning communities were Brownsville, Texas, Buncombe and Durham, North Carolina, each one, Spokane County, Washington, Taos Pueblo, New Mexico, and Williamson, West Virginia. And again, you can see them all here in blue. This year, selected from the 340 applicants, the following 15 communities were selected as finalists. And you can see here the both lists and the representation of those communities, and we are excited to be announcing the winners. Those will be announced on October 28th. Starting this year, we'll be awarding up to 10 prizes, and that will also be the case going into 2016. Again, I would remind all of you that the announcement will be made October 28th, and will be a live webinar announcement from the Robert Wood Johnson for those of you that are interested in tuning in to hear that information live. So with all of that said, and that context about the prize, I'm going to now turn it over to Julie to go into the actual application process.
Great. Thank you so much, Abby. And I'm sure that has whet all your appetites for learning more about what you can do to bring your community into the forefront as a potential RWJF Culture of Health Prize winner in 2016. So let me do a brief overview and then we'll dig into more details. So the prize application process happens in 3 phases. Phase 1, which is the phase we're in right now, and we'll be talking about that in much detail in a few moments. From that phase, we will select about 50 communities to proceed to phase 2, and from those 50 communities, we will select up to 16 finalists who will receive site visits, from whom the up to 10 communities will win the RWJF Culture of Health Prize in 2016. This is a really important deadline for you all to mark on your calendars right now, which is that the Phase 1 deadline is Thursday, December 12th at 3 p.m. Eastern Time. And that is an absolute deadline. No exceptions will be made. Here is the overall timeline for each of the phases that I outlined, that important November 12th date. About a month later, we will send the notification about whether you've been invited to Phase 2. And then January 25th, the Phase 2 applications will be due. By March 4th, we will send a notification of who will receive site visits, and as you will see, those site visits occur April through June of 2016 with announcement of the prize winners in the fall. You'll find all the details about the RWJF Culture of Health Prize application process in our 2016 call for applications. Everything we talk about today will be in that document, and you can access this document at rwjf.org/prize, and we'll be showing you some screenshots of exactly how you get to this in just a few moments. Now, one of the biggest questions that is asked to us is who is eligible to apply for the prize? And this prize is very different than other prizes because it is a prize based on place. And so it is not a prize for a particular organization or a particular accomplishment in your community, but a prize that really reflects the work across the whole geography of your place. So to be eligible to apply for the prize, you must present an application that is the work of a town, a village, a borough, or other local incorporated places, a city, a county or a parish, a federally recognized tribe, a Native Hawaiian organization serving and representing the interests of Native Hawaiians in Hawaii. That's a customized definition of for Hawaii only. Or it could be a region, which would be contiguous towns, cities, or counties. So several counties that work together in an integrated way. Communities within U.S. territories are also welcome to apply. Now, clearly, one of the things you don't see on this list is neighborhoods. So while we understand that in larger cities it can be hard to represent the whole work of the city, we ask you to please strive and do that, because we cannot look at a neighborhood alone. It's perfectly acceptable within the context of a citywide application to feature the good work of a particular neighborhood, but please do so within the context of the broader efforts that are taking place within that town or that city. So, as I've said, the prize honors the work of whole U.S. communities. We'll talk more later in the application process about organizations or coalitions who can take the lead in preparing the application for presentation to us. We know that there will be someone who has to be that author, be that leader, be that convener, but please remember whole communities. We had a webinar question asked ahead of the webinar, which is, what is the most common mistake that voids entries? And part of the reason I'm emphasizing this so clearly is that one of the most common mistakes is that a community presents or an organization presents an application that really does not reflect this whole community perspective. It either is the work of a single organization or a single initiative. So, for example, if you are from the YMCA and you only describe the work of the YMCA, you will not fit this eligibility for the prize. We've also had a question about, can past applicants apply again? And absolutely, you can apply again, with the exception of past winners. We don't let them apply again, and communities that were finalists in the prior year. So those communities in 2015 who are waiting to hear if they've won or not, we ask them to sit out one round before they reapply. But if you have not received a site visit last year and you've applied before, you are welcome to apply again this year. The most important elements about how we select who goes on to become a recipient of the RWJF Culture of Health Prize is how your community performs across the 6 key criteria. And so Abby and I are going to go back and forth and discuss each of these criteria. And this is clearly the most important part of this presentation that we will do today. So the first of the criteria is defining health in the broadest possible terms. You know, building a culture of health means that we use diverse strategies to address multiple factors that influence health. And this This is really built across the county health rankings model of health. So when we talk about thinking about health in the broadest way possible, we are thinking about looking at all of the different health factors that you see in these blue boxes that ultimately drive how long and how well people live. So we are really looking at you to describe a balance of strategies across these factors, but also particularly, given the relative weight of the social and economic factors, we are particularly interested in how your community is moving beyond merely targeting programs to populations in need, but instead taking specific actions to actually improve social and economic factors, such as improving high school graduation rates, or improving access to early childhood education, or improving job training in your community, or improving community safety, or thinking about how people who are coming back from prison are re-entering the community in a way that helps them be whole members of the community. So we're looking for how your community is addressing health from this broad point of view. Abby, let me turn to you for criteria number 2.
Sure, Julie. Our second criteria is a commitment to sustainable systems changes and policy-oriented long-term solutions. And for us, that means making thoughtful, data-informed, deliberate, policy, programmatic, environmental, and systems changes that ensure the sustained impact of those changes over time. So changes that don't go away if the grant ends or the program ends. We really encourage applicants to demonstrate how their partners, how organizations across sectors are creating a common agenda for change, and how that agenda is informed by priorities, and then how they are taking coordinated action and strategic action, aligned action to solve the health challenges facing their communities. So again, I would reiterate that we know no health issue can be solved with a silver bullet. So we're really looking for how communities are piecing together their strategies to improve health. And again, those strategies that go beyond just programs, just services, to think about sustainable change over time.
The third criteria is about cultivating a shared and deeply held belief in the importance of equal opportunity for health. So building a culture of health means that all individuals feel that they have a voice and they have a role to play in improving health in their community. And this really includes sharing a shared commitment to identifying and addressing gaps in opportunities that tend to disproportionately and negatively affect certain populations. So we are asking communities to demonstrate how they foster a community where all people feel a sense of security, a sense of belonging, and trust. And we really want people who are affected by poor health to be part of the power of collective decision-making, of identifying problems, and of identifying solutions to those problems. So a true and rich engagement of all people in the community to create and implement solutions that will improve health.
Thanks, Julie. And then moving on to number 4, which is about harnessing the collective power of leaders, partners, and community members. So this builds on the notion of engaging the community and goes beyond that to recognize that building a culture of health means that we're all in this together and that we are fully leveraging how the many partners in our community can come together around a common agenda for building a culture of health. We encourage applicant communities to demonstrate how those diverse organizations and partners are working together, how business, government, residents, nonprofit organizations, faith-based institutions are working together to develop the infrastructure and strategies for coordination, for moving forward coordinated action, and continuously communicating about their health improvement work. Also, a real commitment to developing community leaders, and that notion that leadership can and should go beyond just those with positional power. So really thinking about leadership coming from different parts of the community to foster that type of collective action and authentic civic engagement. One other piece that I would add here is a reflection from the previous years of the prize is we are not interested in seeing applications from single organizations. We know there are a lot of dynamic organizations that are out doing great work in their community. This isn't an opportunity for an organization to highlight, but really to showcase how multiple agencies, organizations, and partners within a community are coming together to drive change. And so with that, I'll turn it back to Julie.
And the fifth criteria is securing and making the most of available resources. And so this means thinking in a way of a real enterprising spirit. We want people who really think about how they are using the assets of their community in the best way, how they're minimizing waste and maximizing value, how you're leveraging existing assets in the community. I often tell people this is not about who is the best grant writer. It's about the communities that look at what they have in their community and use those people resources, those financial resources, those natural resources to the best of their ability to produce the best value for health. We really want to look at how you're creatively approaching the generation, the allocation, the alignment, and the mobilization of these diverse financial and non-financial resources to evolve and sustain your health improvement efforts. And I think a key you hear here, and you've heard through some of the other criteria that Abby has mentioned, sustainability is really a critical piece here, which is partly why we're not as interested in just seeing how many grants you've been able to secure, but when you've received a grant, how have you fully integrated that into your community's work and been able to sustain that work beyond the completion of the grant period?
And our last and final criteria is about measuring and sharing progress and results. So for us, building a culture of health means thinking and working with that destination in mind, and it means having a commitment to quality and impact in both how the work is done, so the process, and what impact is achieved, thinking about those outcomes. We really want to see in the applications how communities are agreeing upon definitions of success based upon shared priorities and what role data is playing in, again, the identification of those shared priorities and how success is being defined. We want to see how specific goals are being identified, how data and shared measurement is being used to track progress, and also how that information is being used to signal when programs or strategies need to change course because progress isn't being made in the way that might have been expected. We also want to see how communities are sharing data and sharing their outcomes as a way to communicate and celebrate successes and progress along the way as they work towards better health outcomes. So with that, our last and final criteria, I'm going to turn it back to Julie to get into the specifics of how to apply.
So thank you, Abby. As I mentioned earlier, everything that you need in order to apply for the prize is available at rwjf.org/prize. And when you go to that page, this is what you'll see. And when you are ready to start looking at the materials and putting your application together, we invite you to click on that green bar that you see that says Start Your Entry. When you click on that bar, you will get to this page on the RWJF website that provides you with further information. You will see on the right-hand column, key materials, and there is a hyperlink to funding opportunity brochure. and that is the call for applications that I mentioned earlier. If you click on that, you will be able to download the PDF and print it from your own computer. You'll note we also have that available in Spanish. And also, we really encourage you to look at the frequently asked questions document, which you can also download right there. Those frequently asked questions are questions that have been posed by other applicants in past years, and we will add any frequently asked questions that are new that come out of this presentation today to that document, and we'll upload that for you with the new information within a week or so from today's broadcast. You will also see that blue button here on the upper yellow arrow that says Apply Online. And if you click that button, you will get to the myrwjf.org portal. And this is where you will actually work on your application. If you have ever applied at the foundation before, you can just re-enter your email address and your password. You can see there's a place if you forgot your password, they will supply it to you. If this is the first time you are making an application to the Robert Wood Johnson Foundation, you will need to register, and just click on that register button and it will talk you right through the process. So when you get into myrwjf.org, it is going to have a number of different screens that ask you for different information. So we're going to walk through all of those right now. We had a question before the webinar that asked if things have changed from last year's application process. And what I can tell you is that the process is primarily the same as last year, but we have updated some of the language in the prize criteria to more fully reflect what we're looking for. So we encourage you to pay really close attention to those criteria. Again, they are spelled out very clearly in that call for applications that we encourage you to complete. The Phase 1 application, the meat of it is a 5-page essay, which has 2 sections. You will describe your community, and you will also describe your community's 4 accomplishments. In addition, we're going to ask you for a little bit of demographic information, including 2 key contacts from your community. They do not need to be from the same organization, but these will be the 2 people that we will communicate regularly with as to the status of your application. If you're moving on to Phase 2, or if you're not, and so these 2 key people become your key conduits to our staff here at the University of Wisconsin and the Robert Wood Johnson Foundation. So we'll ask you for that demographic information and then this 5-page essay. So in the essay, the first page, we ask you to introduce your community. So tell us a little bit about the community, key physical, social, and economic characteristics, important historical or cultural considerations, really what are your greatest assets, your pressing needs, and how did you get started on this journey towards health? We really want you to make your community come alive to us, introduce us to who you are. And then in the following 4 pages, you will showcase 4 accomplishments. So accomplishments can be specific policies, programs, or strategies that you have deployed in your community that are the best reflection of how you are responding to identified needs and are making progress towards better health. We really want you to think about the 4 accomplishments and how they best reflect those 6 criteria we just went over with you. So really think of, I know this can be hard. I know in communities where you may have many things going on in your community, it can be difficult to narrow it down to the 4 you want to feature in this first phase of the process, but think clearly about the 6 criteria and which 4 would best reflect all 6. So those accomplishments can be relatively new or well-established policies, programs, or strategies. a lot of times people say, how individualized do they need to be? Does it have to be a really, really specific strategy, or can it be a group of strategies? And it can be either. It can be a closely related collection of policies, programs, or strategies. For example, many communities will describe the suite of different activities they're doing to address a pressing need like obesity in their community. And we know most communities in this nation are struggling with obesity. So many communities will feature as one accomplishment the cadre of different strategies that they have done to address a problem in their community, such as obesity. They clearly need to be action moving forward, however, because as you will see, accomplishments may not be planning or convening processes or developing a coalition for a particular project. They may also, your accomplishment may not be your community health assessment or your community health improvement plan. We recognize that creating coalitions, bringing people together, and doing these kind of planning processes are very, very important work, but they are the predecessor for your accomplishments. They are the foundation on which your accomplishments are built. And so we'd like to hear about these kind of things in your introduction, but as an accomplishment, we want to know what actually happened as a result of that coalition coming together and that community health assessment and improvement plan being developed. What happened as a result of it? And when people ask often what leads to your application not moving forward, another common thing can be you do not have 4 accomplishments that meet this definition because you use the development of your community health improvement plan as one of your accomplishments. After you've completed your essay, we have a short worksheet that's kind of an abstract of the information that you've given us so far. We ask you to provide your accomplishment name, a brief description, which of the health factors from the county health rankings model that this accomplishment addresses, and approximately which year that accomplishment began in your community. So this is just a summary of what you've included in your essay. So as I mentioned, you really want to look for a way to describe your community and your 4 accomplishments in a way that helps us see how you're living out those 6 prize criteria. And in the first phase, as our judges look at your criteria or your applications, they will certainly be looking at all 6 criteria, but they will be particularly honing in on the first 3 to decide who moves to phase 2 of this process. So we want to be very transparent about that with you and let you know that is what we'll be looking at. So we'll be very clearly looking at defining health in the broadest possible terms, committing to sustainable systems change and policy-oriented long-term solutions, and cultivating a shared and deeply held belief in the importance of equal opportunity for health. For those of you who are invited to move on to phase 2, there will be an opportunity for further expansion on the work of your community. So there's a second brief essay of another 5 pages where you can offer a more full picture of health improvement efforts. So you will be able to describe for us all the things you didn't include in phase 1 during phase 2. And we'll also ask you for some specific questions to further share with us about how your community is working on particular criteria. We also will ask you to prepare a brief multimedia presentation so that we get a visual introduction to your community. And I can tell you last year our judges really relished those videos and found them to be very helpful to bring life to the words on the paper. And the last thing we would ask you to do in phase 2 is prepare a draft site visit itinerary so that we know what you would show the judges if they came to your community to visit you. So again, these are only for people advancing to phase 2. but we wanted to let you know what you could look ahead to if you were asked to move forward in the competition. We've been asked if there's any advantage or disadvantage for past applicants to apply. Again, we want to encourage you to think about these criteria, think about this process, and if you're a past applicant and you feel you've made progress and you can address the criteria even better than you did last time, we welcome your application. And we know this is a continuous journey, and we welcome hearing how you have progressed in your journey since last year. There is no disadvantage to reapplying. And the last phase, again, is the site visit phase. And this is where we give life and voice to phase 1 and phase 2. Again, up to 16 communities will be asked to move forward as a finalist into the site visit phase. And during that phase, 4 to 6 site visitors from the Robert Wood Johnson Foundation, from the University of Wisconsin, and from our panel of national experts will come and spend about 24 hours in your community. They will go on a tour of your community, they'll have dinner with leaders from your community, and then they'll have a conversation with a wider representation of people from the community. Again, in addition to the essay and the worksheet, this is what we will need from you in phase 1, that primary contact and an alternate contact. In phase 2, we would ask you for any changes to those contacts, and at phase 2, we will also ask you for who would receive the prize money if you are chosen as a recipient of the Culture of Health Prize. And we would also ask you for permission to use the content that you have submitted to tell the stories of building a culture of health. So again, can any community win? Yes, any community can win. As you have seen in our past prize winners, we have had large places win, small places win, tribal nations win, and so it really is about helping us understand how you are working to create a healthier place to live, learn, work, and play in regard to the 6 prize criteria. We are looking for unique approaches. So don't feel like, well, we encourage you to look at the videos and the stories from the past prize winners and learn from them. We are not asking you to be a cookie cutter replication of what you saw in Spokane, Washington, or Cambridge, Massachusetts, or Williamson, West Virginia. We really want to hear the depth and breadth of what is happening in your community as we seek our next prize winners. So that brings us to the conclusion of the formal process here. We'll leave this screen on while we go to questions and answers, so you can see links to both, again, where you can find information and apply for the prize, the frequently asked questions, the call for applications, and then members of our prize staff here at the University of Wisconsin, Carrie Carroll, Olivia Little, and also Karen Odegaard, who are all with me today answering questions in the background here and producing this webinar. They all stand ready and willing to answer further questions or be of assistance to you as you move through the application process. And you can see our email address and phone number there. So we're going to move to questions now, and let me just take a moment to get resituated here. And our first question is, what constitutes readiness to apply for the award? Abby, would you like to comment on that?
Sure, Julie. I'll start with some general reflections, and then you might have more to add with some specific tools that folks can use. What we have heard from prior applicants and also prior non-applicants who started the process was that they used the application and they used the question to have a conversation with their key partners. And what some folks told us is they didn't know who to have the conversation with. And I would say that's a first stage of readiness, that assessment of, is there a natural set of partners, coalition that can come together to talk about this opportunity. I think the criteria become a natural conversation starter to assess, how is the community defining health? Is there a broad definition? Is there a body of work that can be pointed to and elevated? There is not a sort of a switch that goes on that would say a community is now ready to apply for the prize. We have recognized communities that are earlier in their health improvement journey and some that are much more mature. And so it's not to say that, again, there's a certain point at which a community becomes ready. But I think a lot of that has to do with, can you bring the right partners around the table? Partners that are not just introducing themselves for the first time, but partners who can reflect on a body of work and assess how the criteria can apply to them. So, Julie, other points you want to add?
No, I think those are all right on target, Abby. And one thing I can encourage people to do is, as Abby said, look at the criteria. And there is a tool on the County Health Rankings and Roadmaps website called Poised for Progress. So if you go to County Health Rankings and Roadmaps and download the Poised for Progress tool, that asks a lot of questions about how a community is ready to take action to improve health and where you are along the journey towards there, and can be a really helpful self-assessment tool as you think about applying for the prize. So that could be one additional concrete piece of information that would be helpful to people. All right, we have another question here that is, do you need to address all factors of health, or can it be targeted to one aspect of health? Let me start on that one, Abby, and then you chime in if I've missed anything. We would, as you look at criteria number 1 and think about that broad view of health, we are really looking to communities who are working in a number of different areas of that model of health. So I mentioned people often collect suites of services to address obesity. It would not be a competitive application if you just said, our health issue we're dealing with is obesity, and here are 4 different accomplishments that we're doing to address this issue. So we are looking for people who are looking at strategies across different health factors. There is not a litmus test at the end of phase 1 that says they must have 1 in health behaviors, 1 in clinical care, 1 in social and economic factors, and 1 in the physical environment. But if you were only focusing on one of those areas, I would say your application would not be highly competitive. Abby, anything you want to add to that?
No, I think you made the point exactly, Julie. Thank you.
All right, I'm looking at some of the other questions that are coming in. All right, how about this one? How are whole communities able to come together to tell their story of creating a healthy culture from multiple angles?
Do you want me to jump in on that, Julie?
I was just going to say, Abby, you want I was pondering my own answer.
Well, I think pondering that is right, because I don't think there is one answer. And I think for us it's important that the story that the community tells be one that is authentic to them. And if you look across the the materials, the blog posts, the videos that have come out, and I would encourage you to pay attention to this year's as well, there are different voices. And all of the voices of the community story, different parts of the story, add up to a broader narrative. And I think that is what is unique, is that the community sees that broader narrative, that you can have elementary school principals. You can have local health department leaders. You can have police officers. You could have a local faith leader, a community resident, all tell their story, but have the story, add up to a broader picture of what's happening in that community, that those stories fit together. In some of those stories, what we find is that history is an important part of it, that, multiple initiatives come back to certain moments in time in the community that triggered certain actions. And so we really like the work and the stories of the community to be put in that context of, what was it that triggered these changes? And oftentimes community members can point to several events along the way, and that can be a uniting kind of leaf, something that gets woven through the story that they tell. Some of the communities that we have recognized, come up with these wonderful analogies to talk about their work, tapestries or quilts. But in many cases, it's the weaving together of many individual stories, again, to tell the bigger community story. So there's not one way, but I would say those are some of the common themes that we see.
That's all really helpful, Abby. And one thing that I would add is this is also why you find that we have such a long application period. We released this call for application on August 10th. It is not due until November 12th. And so it is an opportunity for you to come together with people in your community, to bring together people who are addressing health factors from a variety of different areas and coalesce those efforts. And we've heard from many people that the prize application and the process of putting the prize application together actually accelerated their efforts in their own community. And we've heard this not only from people who have won the prize, but from applicants for the prize who didn't move forward, who said it didn't matter because the opportunity to bring people working on educational policy together with people working on creating healthier environments for eating and moving, and bringing people together with people who are working on housing, and people from the business community who are working on economic development, and people from the healthcare community who were working on healthcare quality, all to think about this application created other synergies in their community that were really positive. So it goes to another question we have here, which is, what is the process and time commitment to write a winning application? And I think I've just alluded to that for you, is that this is not the kind of application that you assign to a staff member who goes into their office and hammers out 5 pages to submit. That it is a process of calling people together to think about this application, but we hope also, as part of putting the application together, to accelerate and advance your work. So there is a significant time commitment to write a really good application, but we're really hopeful it's well spent time in the broader context of your efforts. We had a question here earlier about blue zones and a community who had met the standards for blue zones and was wondering about drawing on their successes there. And I would just add to, I just see that one of my colleagues answered that question in writing to the particular person posing the question, but I just want to say we've had a number of applications in the past who were working through the Blue Zone certification process, and that you will notice there's a lot of alignment with what is happening with Blue Zones and the culture of health. And so I think it's a great foundation on which to stand, but you will want to customize it to be sure that you're addressing our criteria and thinking through the particular components of the Culture of Health Prize application process as well. So let's see, we have a few moments here. I'm just looking at. So we have an existing coalition that has a record of accomplishments. It is run by a not-for-profit organization, but includes a depth and breadth of community membership from government to hospital to community agencies and members. Would we be eligible to apply? Again, that could be the coalition that would serve as the key lead applicant, that you would be the key contact for your community's application. To answer that question more fully, we would want to know, what is the coalition focusing on? Does your record of accomplishments address the different health factors? Have they been deployed in a way that they're sustainable, that they're focusing on policy systems and environmental change? Are they targeted at a place, at a city, at a town, at a county level? Those would be the kind of questions that we would want, that would more fully answer that, whether you're a good applicant. But clearly, a well-established coalition is often the key contact. The key contact for the application process comes from a coalition. All right. Abby, I'm going to pose this one to you to begin with. What type of data should a community be ready to submit with their application? Stories or statistics, process or outcome data, short or long-term outcomes? What are we looking for in terms of data with the application?
Sure. Well, the whole application process, if you think about all three steps, will give an opportunity for you to showcase all of that. As you present your initial application, I would encourage you to put forth the data, both the stories, the qualitative, the quantitative, and outcome measures that you're most proud of. I mean, this is really your opportunity to tell the story you want and to put that forward. So that is you know, how I would start. The subsequent second phase application gives you the opportunity to share even more depth. And I'll tell you, the site visits do become a real opportunity to pull all of that together. And we've seen communities do a really nice job in using, you know, both the process outcome data that they have, and then, you know, coupling that with the stories. Julie can talk more about where, you know, reports or studies that you want to cite, if you have them, can be provided. But that's not typically something that we're looking for in the first phase application.
That would be correct. And if you move forward in the application process, oftentimes part of what communities provide to us in the site visit is, for example, a copy of their community health assessment and improvement plan, a copy of their annual report back to the community that discusses how they're moving forward on their variety of initiatives to improve health across all of those factors. And so, you know, what we want to know in this first phase is, what are you doing about collecting and measuring data, and a few pearls if there are some outcome pieces that you have for us. But again, in 5 pages, you won't have that much room. Well, we come to the top of the hour now, the conclusion of our time together. We really want to thank all of you for your interest in the RWJF Culture of Health Prize. We're very excited about this year's competition and are very much looking forward to reading the stories and accomplishments from your communities. It is always a very, very uplifting part of all of our work lives to hear about the incredible work each of you are doing in your community. I know a number of you have asked about past prize winners, excuse me, and their accomplishments. And again, I direct you to rwjf.org/prize. At that site, you will also be able to read a story about each of the previous 12 prize winners, and there are also 4-minute videos that further capture those communities' work. And so, excuse me, watching those videos can be very, very helpful to further get a sense of what some of the other communities have done. But again, as we close, we want your story moving forward. So thank you all so much for joining us today. Again, these slides and a copy of this recording will be posted at rwjf.org/prize within the next week. And so if you want to share this with other members of your community, feel free to direct them to this recording or the slides. And again, if you have questions throughout the application process, please do not hesitate to contact my colleagues here at the University of Wisconsin at prize at match.wisc.edu or the phone number you see on the bottom of the screen. Thank you all, and have a great day and remainder of your week. And thank you, Abby, for being with us today.
Thank you, Julie. Thanks to all for joining. Bye-bye.
All right. Goodbye.